If you are without health insurance in the Houston metro area, you do have hope thanks to the Ibn Sina Foundation, partners in promoting community health.
Ibn Sina's mission is very clear. We need to support low-income, uninsured population who have no access to healthcare services. And we also have a mission to provide improving the quality of the life of individuals who are living in the neighborhood. The mission is also to work on primary care services and prevention programs that control the disease and improving the survival among the communities in the neighborhood.
Ibn Sina Foundation is a nonprofit organization operating 4 clinics where the cost to see a physician starts at just $25. But no one is turned away for inability to pay.
Some people may have health insurance, but their deductibles are too high, so they can't afford to see the doctor, or they have no insurance at all. And so we just offer primary care to these individuals to address their chronic diseases or acute diseases.
The Ibn Sina Foundation was established in 2001. A group of local physicians, other healthcare professionals, and concerned citizens saw the need to provide healthcare to an expanding population of uninsured and medically underserved individuals.
We need to support low-income, uninsured population who have no access to healthcare services. And we also have a mission to provide improving the quality of the life of individuals who are living in the neighborhood. The mission is also to work on primary care services and prevention programs that control the disease and improving the survival among the communities in the neighborhood.
Each of Ibn Sina's community clinics offer primary medical care, including gynecology, pediatrics, and dental services. The first Ibn Sina clinic was established in Southwest Houston in 2001 on Willcrest Drive in a small facility with limited hours, but demand quickly grew.
The clinic was constantly growing. Patients were coming, and then we were seeing the patients up till 11 o'clock in the night, and they were actually coming, so there was a long waiting time. There was too much rush. There was no big waiting area. There's a small space, and there was only 2 exam rooms. So it was very, very tough situation. But now we have multiple facilities. They are huge facilities. Then patients can easily access and comfortably sit and get the care.
That small facility grew to this full-service clinic, where the grand opening was celebrated by the foundation leaders, city and state officials, including Governor Rick Perry. It's a beautiful modern facility, shattering the stereotype that community clinics are housed in ugly, rundown, depressing buildings.
Poor people does not mean that they can go to the broken offices or something like that. They would also be given respect. They must be treated with dignity, and they must be having equitable and quality care within their institutions. So that's what we are having a nice facilities. But we are not that expensive, elegant facilities that the community think that this is not for them. This is a clinic that is neat, clean, affordable, and easily accessible. That's what we built it.
Within a decade, Ibn Sina opened the doors to 3 additional clinics, one in Clear Lake, one in Port Arthur, and the newest facility in South Houston on South Post Oak, an area where primary medical care is scarce.
It is a vision come true. I think it's a dream come true for the foundation, and we look forward for many more clinics in this city of Houston.
This is simply an opportunity by the God to help the people who need. And this is the challenge, and we hope, wish, and pray that we fulfill this challenge by helping whatever we can do to the population who don't have access to the health. I'll be very happy and satisfied if we can take care of the chronic conditions and prevent them from going to the secondary or tertiary level. Our presence here would be an opportunity and access of health to the people who don't have otherwise.
Now this one starts from dental. So this is dental chair 1.
The newest Ibn Sina clinic features new technology throughout the facility so that patients get exceptional primary care, dental care, and other services delivered in the most modern medical facility in the area.
So this one here, this connects the corridor, connecting.
So this is the separation between the 2 sides.
2 sides, yeah.
So all this is dental and this is your medical center. Okay.
Right.
The shiny new clinic was shown privately to both Houston City Councilwoman Wanda Adams and Fort Bend County Commissioner Grady Prestige, both of whom played key roles in making this clinic a reality.
Okay, so this is the lab area here, and these are the medicine rooms, 2 medicine rooms.
Services at all Ibn Sina clinics include immunizations, screenings for diabetes and heart disease, low-cost lab services, and prescriptions. The medical staff works hard to educate patients about preventive health habits such as proper nutrition. There are even special classes to help diabetics understand their condition and how to take better care of themselves.
What we did is that Ibn Sina, in collaboration with the state of Texas, have developed a program, an intervention program for the people in the community. So they will get some interventions. So through that, they can control their blood sugar and they can change the quality of their life.
Ibn Sina clinics now treat more than 60,000 patients every year with a goal of serving 100,000 patients by the year 2020. There's a vital need for the services provided by these clinics because health is taking a backseat to other pressing needs faced by economically disadvantaged families and individuals.
Major challenge to us is what? Patients cannot afford the money and they cannot have it. This point in crisis, they need to food on the table rather than a healthcare insurance. So what is the priority? Priority to them is to feed the families. Low cost approach would help them to access to healthcare services and control the disease, and been very successful in controlling cardiovascular disease and done so many screening programs. Similarly, with the collaboration Rose Breast Cancer or an MD Anderson, we have done breast cancer screening programs. We have done so many prostate screening programs, and with that we identified the patient at early stages, then treatment have been done for those patients.
The help of the business and human services community is vital in continuing to care for the population served by Ibn Sina. Collaborations with other health services agencies are accepted and welcome so that Ibn Sina can offer the most comprehensive services possible at the lowest cost possible.
What we try to do is address issues that are limiting their access to care, either social or economic issues, making sure they have affordable medications that they can take on a daily basis, and then stress compliance, diet, exercise, etc. And then wanting follow-up with them, to see them again in a few weeks, a month, or whatever is necessary. So there's continuity of care and not this on and off care that can lead to, disasters down the road.
I wish I would have found this clinic 6 years ago when I started practicing. I think it's such a great resource for the community. You hear patients all the time, I didn't even know that this place existed, and I'm so glad that I found you, and you're providing such a great resource, and I wish we could open one all over, kind of in every city, but because you'll hear people, I drove 30 minutes just to come see you, and so definitely the need is there.
To continue that continuity of care, donations of both dollars and volunteer hours are needed.
So there are different ways to do it. A, they can help us in terms of building constructions. B, there are medical equipments that are needed, and then there are operating dollars are needed.
The Ibn Sina Foundation, providing primary medical care in communities that need it the most. Ibn Sina Foundation partners in promoting community health.